We've received a lot of great questions about the state's COVID-19 vaccination plan, specifically along the lines of, this is my age, these are my health conditions, when can I get the vaccine? But it's not that easy to answer some of these questions because the vaccine timeline in Montana is not the same as it originally was in November or even last week.
We are currently in the process of working through a system to begin expanding vaccine distribution specifically to the following groups. All Montanans of 70 years of age or older, and Montanans age 16 to 69 that have specific underlying health conditions that make them more vulnerable.
Let's look at the changes the state's vaccination plan has undergone. The first draft of the plan sorted initial distribution of the vaccine into 4 phases: critical infrastructure workers, people at increased risk for severe COVID-19 illnesses such as long-term care facility residents, people 65 and older, and anyone with underlying health conditions, then people with increased risk of transmitting the virus and people with limited access to vaccines. In late December, Governor Bullock announced the distribution plan had changed, and so had the timeline. Frontline healthcare workers and long-term care facilities were in Phase 1A, people 75 and older were in Phase 1B, and people 65 plus or with underlying health conditions fell into Phase 1C. That was less than a month ago, and now the plan has been changed again.
I have tasked DPHHS and General Quinn to begin the process of revising the vaccine distribution plan to prioritize the most vulnerable in our communities.
While Phase 1A remains unchanged, Phase 1B now includes anyone 70 or older instead of 75, and anyone with a high-risk medical condition. Phase 1C includes other frontline essential workers, anyone over the age of 60, and people with a, quote, elevated risk of COVID-19 complications. We've asked the Montana DPHHS a number of other questions that you've sent in as well, but we're still waiting to hear back as the state continues to adapt and change the vaccination plan based on guidance from officials and vaccine availability. In Great Falls, Matt Holzaffel, MTN News.